The project that we're working on has to do with asbestos exposures, and the way we got started doing that work had to do with a population of people up in Libby, Montana who were exposed to asbestos because of vermiculite mining, and the vermiculite was contaminated with asbestos. People up in Libby came to us and said, why is there so much autoimmune disease here? Not only the cancers, the asbestosis or the fibrosis, the scarring of the disease, but also other strange diseases like systemic lupus and scleroderma. So they came to us and asked if we would study it. I was at the University of Montana at that time, and we took a look. And what we did was just simply screen the patients for the presence of autoantibodies, that is, antibodies that might damage the person's own tissues. What we found was that the people up in Libby who had had the asbestos exposures did indeed have a higher frequency of these autoantibodies. Compared to a control population, we used Missoula as our control population, where the University of Montana is. After that, there were a lot of questions that came out of that research asking about the significance of those autoantibodies. Did they cause disease? Did they occur early after the exposure? Did they follow the fibrosis? Were they a marker or for future pathologies that might develop? So this new project expands well beyond what we initially did in just screening those people, and asks several questions about not only their lung disease, their cancers, and their fibrosis, but also their immune systems. So one of the questions that CDC and the Agency for Toxic Substances and Disease Registry that is funding this project is asking is whether the levels of asbestos currently in Libby, Montana are safe. The EPA has been in Libby and around the mine area cleaning up for several years now, and hopefully have reduced the levels of asbestos to very, very low levels. So we'll be looking at a variety of parameters in conjunction with a group of researchers at Mount Sinai Medical School in New York, and also some researchers at the University of Montana. And our whole goal is to find out whether short exposures, such as people who have just recently moved into Libby, have a reduced risk. For Idaho State University, this is an opportunity to be involved in a national research program exploring the health effects of asbestos exposure, and the whole grant that's going to the Mount Sinai Medical School is about $5 million spread out over 5 years. And out of that, each year, we will get a portion of that in order to do our studies. The total that ISU will receive and our laboratory will take advantage of is about $290,000. What we'll do with that money is